Alrighty, welcome back. We're going to pick up here with lymphoid cells and a little bit about different types of lymphatic tissue that we can find throughout our body. So these lymphoid cells, these lymphatic cells that we're going to talk about, these will also come back to us when we get to the immune system. Okay, so these are going to be involved with both lymphoid tissue, with lymphoid cells, but they're also going to be part of our immune system pretty heavily. There are two types, there's two divisions essentially of our immune system. There's humoral immune system and our cell-mediated aspect. And so you'll see different cells in different parts of the immune system. But for now, we'll introduce them as they relate to the lymphatic system. Okay, so these are going to be our lymphocytes. Okay, so when we get to the immune system, we'll talk about how there's neutrophils and lymphocytes and eosinophils and monophils and basophils and all of those. But the part of the cell, the main cell type of our lymphatic system is going to be obviously our lymphocyte. So it's a type of leukocyte. Okay, so don't confuse lymphocyte with leukocyte. Lymphocyte is a type of leukocyte. Okay, so maybe you remember that from our blood lecture. Whenever we looked at the cells of the blood, we talked about T cells and T lymphocytes. That's what we're talking about here. So we have T cells and we have B cells. Now, the origin of these cells, they're both going to originate in the same place. They're both going to originate in our bone marrow. So if you remember from our blood, our bone marrow is where we had that hemocytoblast, that undifferentiated stem cell, and then as it progresses and divides, it has the capability of ultimately leading to all of our different types of blood cells, including here our T and B cells. Okay, so they both mature in the bone marrow, but they originate in the bone marrow, but they mature in different locations. So the T cell is going to mature in the thymus. So T, thymus, you can associate those two things together. And these are going to be our attacking cells. So they attack foreign cells or cells that we'll consider non-self. So they're not native to our bodies. Okay. There's also the B cell. Again, originates in the bone marrow, but these cells also mature in the bone marrow. So you can think about the B standing for bone marrow, but what it really stands for is the bursa of Fabricius, which was that region in birds and in chickens where these cells were initially and originally found. But for all intents and purposes, if you want to think about the B and B cell or B lymphocyte as standing for bone marrow where they mature, that's perfectly fine. What these B cells will do, they can have membrane-bound antibodies that are bound to them. So when we get to the immune system, we'll talk about that. These B cells can then further differentiate into something called a plasma cell. And then the plasma cell is what actively secretes thousands and thousands of antibodies per second. So sometimes they're referred to as the antibody factories because when they differentiate from the B cell, they then secrete thousands and thousands of antibodies per second. And the antibodies are what drift and float and attach to our different antigens to essentially neutralize them and help in the immune response. So there's lots of talk about antibodies in the news right now with the COVID vaccine and whether boosters are needed, if they're helpful, and exactly how long the COVID antibodies are staying in our system. So there are different antibody titer levels and how frequently you have to get those replaced. So some you go get a booster of a tetanus shot. You get that once every 10 years or so, and then others like the flu, you're supposed to get that every year. So it just depends on which specific thing you're talking about. But what actually secretes these antibodies in our living cells in our living tissue is going to be the plasma cell. Okay. Now, there's also a dendritic cell. So a dendritic cell is going to be found in the skin. So if you think back to AMP1 and you think about the integumentary system, you talked about dendritic cells and how they're a type of immune cell, a type of macrophage that's going to be present in the stratum spinosum of the skin. And now it was named dendritic cell because it had these little dendritic processes, these little processes off the cell that looked like dendrites. They're not dendrites, but they look like it, so we call them dendritic cells. But what these do is they participate in our lymphatic system, and there's something called an antigen presenting cell. And so we'll talk about antigen presenting cells with the immune system, but essentially what they do is they can engulf a pathogen or an antigen, bring it in, process it, and then present parts of it on its surface. So it presents the antigen. So that's why they're referred to as antigen presenting cells. And then they'll interact with our T and B lymphocytes. So those are the cell types of the lymphatic system. Now we can look at some of the tissue types of the immune system. So these different tissue types contain the cells that we just talked about, and they're present in different parts of our body that if that part of the body happens to encounter a pathogen or some type of foreign antigen, there are immune cells located within that tissue that are available and ready to respond to that if needed. Okay. So one type is a diffuse lymphatic tissue. These are going to be unencapsulated bundles of lymphatic cells. So what we mean when we say unencapsulated, what they really are is they're not very well circumscribed. Okay, so there's not a distinct line that shows, okay, this is where this tissue stops or starts, and then this is where the rest of the type of tissue, whether it's in the digestive tract or respiratory tract or wherever, there's not a really demarcating line saying this is where the lymphatic tissue stops, and this is where the rest of the tissue begins. So it's diffuse, essentially. It's not very well, you can't differentiate it a whole lot. Now you can a little bit, but there's not a very nice circumscribed area that shows you this specific region here is the lymphatic tissue. So what is contained in it are our lymphocytes, so our T and B cells, as well as general macrophages that'll participate in phagocytosis, so the engulfing of different types of foreign antigens and pathogens. They're located in the mucous membranes of different systems, so part of the respiratory tract as well as our GI tract. In the GI tract, when we look at it with the digestive system, we'll see a tissue called the lamina propria, which is a loose connective tissue, but in it there is lots of immune cells and plasma cells, and so that would be an example of a type of diffuse lymphatic tissue. Now, there are also things called lymphatic follicles or lymphatic nodules, and these are also unencapsulated bundles of cells, but they have a little bit more defining borders that you can pick out when you look at it histologically. So we'll look at Peyer's patches, tonsils, and our appendix. We'll look at all of those, and you'll be able to see much more easily exactly where they're located because they look like these little nodules. Okay, there are ones that are located specifically in parts of our mucosa that are called mucosa-associated lymphoid tissue. Sometimes they're just called MALT. And the Peyer's patches, tonsils, and our appendix are examples of this MALT, this mucosa-associated lymphoid tissue. So the mucosa, just for a reference, the mucosa is really the essentially the lining of an area or a region. So what you can feel on the inside of your mouth if you move your tongue inside your mouth, that inside of your mouth and your cheeks there, that's your mucosa within the inside. You also have a mucosa within your esophagus, within your stomach, and then throughout your small intestine as well. So it's just this specific layer, and we'll get to the specific layers when we discuss the digestive system. So we'll take a look here at some of these lymphatic nodules. So what you can see here, this is Peyer's patches. So Peyer's patches are located primarily in parts of the ileum, the distal ileum. And what you can see on this left image and then this right image is the same thing, but just zoomed in a little more. You can kind of see this circular region here. So this circular region is going to be the Peyer's patch. And what you'll have is this more centrally located lighter region called the germinal center. And in this, you'll have different types of cells. And then on the outside, you'll have some more lymphocytes that are surrounding it. But you can also see it in this more zoomed out image, this kind of circular circular region. So when you go to histology guide, if you go to this website, histologyguide.com, and you click on gastrointestinal tract and you look at the tissue types there, you'll be able to see Peyer's patches. You can look at the appendix, you can look at tonsils, and you'll be able to see these and move around and look at them a little more closely. So here are our tonsils. What you can see is we have pharyngeal tonsils, palatine tonsils, sometimes called your adenoids, and then your lingual tonsils. So lingual are associated with your tongue. You have your palatine tonsils associated with your soft palate here, and then you have a pharyngeal tonsil way up here in your nasopharynx region. And so these will also contain clusters of lymphatic tissue that will, sometimes your tonsils will become large. You can have a tonsillectomy, where if you have consistent and persistent infections, you can have some of your tonsils removed. Generally, your adenoids can be removed. But what they contain is that lymphatic tissue with lymphatic cells that serve to protect us against foreign pathogens and antigens during an infection. And lastly here, we can see the appendix, sometimes called the veriform appendix. Now, it was for a long time thought to be a vestigial organ, so something that really no longer serves a purpose. It's just a remnant and we still have it. But it's been known for some time now that it's actually not completely vestigial. You can live without it. You can have an appendectomy and have your appendix removed and generally be fine. But what it does, it contains some lymphatic tissue like we've talked about, but it also contains some of your normal healthy bacteria, so your normal flora that is present in your digestive system. That is good. It's good bacteria. So again, when we get to the digestive system, we'll talk about how not all bacteria in our body is actually bad. We actually need some present in order to prevent overgrowth of bad bacteria, which would ultimately lead to more serious infections whenever you have an overgrowth of a bad bacteria. So you can see it hanging off this most beginning portion of the large intestine called the cecum. So you can see it here and you can see it here. So it's just this little pouch-like structure. And there are different arrangements of the appendix. You can have it located in different places. You can have it, some people have larger ones, but it's living tissue just like everything else. So it's going to receive blood supply. So you can see an appendicular artery traveling to the appendix and supplying it with a blood supply. But this is an important understanding where this is in the body and in your abdominal quadrants is really important for healthcare settings and clinical implications. It's in your lower right quadrant. So oftentimes if patients are experiencing severe pain in their lower right quadrant, there are different tests you can perform. There's a McBurney's test, which tests for rebound tenderness. And so you would push in on the patient's abdomen in that right lower quadrant. And then whenever you let go, as it's rebounding out, they have increased pain. And so that's generally a positive clinical sign when they have that. That can help to diagnose appendicitis. And so depending on the test and depending on the severity, you may need to have an appendectomy in which that appendix is removed. So here you can see portions of our appendix. This is a histological section. So you can see a nodule within it. So this is all lymphatic tissue. And you can see different layers. So you can see a mucosa layer. You can see submucosa, and then some muscularis layer. And again, we'll talk about that specifically when we get to our digestive system. So we will then, I'm going to pause here, and we'll pick up hopefully with our last section with lymph nodes.